Hello, my name is Jean-Claude Bisimwa Rusanga. I'm from the Catholique University of Bukavu, and I've been working on research projects on diarrheal diseases and cholera for 8 years in partnership with Johns Hopkins University. I would like to thank the EHF organizers for this opportunity. I will be presenting on risk factors associated with diarrhea among children under 5 in urban settings in South Kivu, Democratic Republic of the Congo, as part of the PICHA 7 program. The rationale behind the PICHA 7 program is that when a diarrhea patient presents at a health facility, their household members are at a higher risk of developing diarrhea compared to the general population. This risk is highest during the 7 days after the diarrhea patient is admitted to the healthcare facility. Despite this high risk, there are limited interventions for this population. The preventive intervention for cholera for 7 days, or PICHA 7 program, was developed through 18 months of community-centered formative research. This included semi-structured interviews and a pilot study of 518 participants. The PICHA 7 program is healthcare facility initiated, with a health promoter delivering a pictorial wash model bedside to diarrhea patient, and they are accompanying household members, promoting hand washing with soap, water treatment, and safe water storage. An hygiene kit is also provided with a hand washing station and a water vessel with a lid and tap. Quarterly home visits are conducted every 3 months by a health promoter. Community health workers are part of the health system in our study setting. Finally, a mobile health program is delivered where a doctor at a local hospital named Dr. Picha sends weekly automated voice and text messages to diarrhea patient households over a 12-month period. For this presentation, I'll be focusing on the prospective cohort study conducted of the PICHA 7 program, conducted from 2021 up to 2023. The main results from the PICHA 7 trial have been presented elsewhere. With my study, I focused on investigating which wash risk factors have the greatest impact on diarrhea and growth for the children enrolled in the PICHA 7 prospective cohort study. This slide shows the fecal exposure pathways where children are infected with diarrheal diseases through oral exposure to fecal pathogens. Through gaining an increased understanding of the fecal exposure pathways in Eastern DRC, we can further tailor the PICHA 7 program to improve growth and reduce diarrheal diseases in children. In total, we enrolled 794 children under 5 years of age in our prospective cohort study in urban Bukavu, a city in South Kivu province of Eastern DRC. After enrollment, children were followed for 12 months. During the 12-month follow-up period, diarrhea surveillance was carried out monthly, with the height and weight of children assessed at baseline and 12 months. Spot checks of the household compounds were performed at baseline and monthly to assess wash risk factors, including the presence of animals and feces on the household compounds and the household sanitation options. We also completed 5-hour structured observations to assess wash behaviors. Our first outcome is the association between individual and household risk factors and diarrhea at the subsequent surveillance visits. We defined diarrhea as 3 or more loose stool in 20-hour period in the past 2 weeks. We looked at several wash risk factors for diarrhea in children under 5 years. All factors were adjusted for age, gender, and socioeconomic factors. First, we found that soap presence in the toilet area of the child's household was protective against diarrhea in the subsequent month. In a stratified analysis comparing the control and PICHA 7 arms, these findings remained consistent. Next, we also found that Children with animals present in their sleeping space had an increased risk of diarrhea, significant when assessed through research officer observation and through caregivers' reports. An improved sanitation was also associated with increased diarrhea. As well as consumption of food outside of the homes in the past 2 weeks. I would like to conclude my presentation today by thanking the study participants that participated in our research activities. Thank you to Welcome for funding our work, and to my colleagues at Catholic University of Bukavu, Johns Hopkins University, and the DRC Health Ministry. Here we share our 6 recent publications from the Picture 7 program. I will be happy to answer any questions. Thank you.